Over the years, I've heard countless myths and misconceptions that cause confusion and frustrations for patients. Today, we are going to tackle 10 of the most common myths about lipedema, providing you with expert insights so you can be better informed and empowered. My name is Dr. Alexey Markelov. I'm a double board-certified plastic surgeon specializing in lipedema treatment. Let's start with perhaps the biggest myth, that lipedema is simply a matter of being overweight. This is fundamentally untrue. Lipedema involves a disproportionate deposition of pathological fat, typically in the lower body, legs, buttocks, hips, and sometimes in the arms, often sparing hands and feet. Crucially, this fat behaves differently than typical obesity-related fat. Patients often have a normal-sized upper body, creating distinct disproportion with the lower body. We see the differences at the cellular level actually, and importantly, this fat is highly resistant to traditional weight loss methods such as diet and exercise. This ties into myth number 2. You can diet and exercise lipedema fat away. While a healthy diet and regular exercise are absolutely crucial for managing overall health, preventing general weight gain, which can worsen lipedema, and potentially reducing inflammation and symptoms, they cannot eliminate established lipedema fat. My patients often tell me they have tried aggressive diet and exercise regimens, sometimes losing very significant amount of weight from the upper body, while the lipedema areas remain stubbornly large and heavy. This is why specialized treatments are often necessary for lipedema patients. Myth number 3. Lipedema is rare. Not at all. Current estimates suggest lipedema may affect up to 11% of adult female population worldwide. That's millions of women. The issue isn't rarity, it's under-recognition and misdiagnosis. Many women suffer for years being told they just need to lose weight before finally receiving the correct diagnosis. So increased awareness is the key. Myth number 4. Lipedema only develops later in life or after major weight gain. Lipedema can certainly worsen over time or with the weight gain. Its onset often linked to hormonal shifts. It commonly starts or significantly worsens during puberty, pregnancy, or menopause. It can absolutely affect young women and those who have always been slender in the upper body. It's not dependent on being overweight to begin. Myth number 5. Lipedema isn't painful. This is a major misconception that dismisses the patient's suffering and the symptoms. Lipedema fat is often tender to the touch, painful, and associated with feeling of heaviness and aching. Easy bruising is another hallmark symptom. While the exact cause of the pain is complex, inflammation and pressure likely play a very significant role. This pain is the key reason why lipedema is not just a cosmetic issue. Moving on to myth number 6. Lipedema only affects the legs. While the legs, hips, and buttocks are the most commonly affected areas, lipedema can also affect arms, usually symmetrically, often sparing wrists and hands, similar to how it spares ankles and feet in lower extremity lipedema. Recognizing potential arm involvement is important for a complete diagnosis and the treatment plan. Myth number 7. Lipedema doesn't involve the lymphatic system, or it involves it in a very late stages. This is critical misunderstanding. While lipedema is primarily a fat disorder, it has a close relationship with the lymphatic system from early on. The abnormal fat can pressure on delicate lymphatic channels, impairing their function, and over time can lead to secondary lymphedema, a condition called lipolymphedema. This is precisely why lymphatic-sparing surgical techniques are absolutely essential when treating lipedema with the liposuction. Next myth is number 8. Nothing can really be done about lipedema. You just live with it. That's an absolutely false. While there's no magic pill, there are effective management strategies and treatments. Conservative measures like compression therapy, lymphatic drainage massages, and maintaining healthy lifestyle can definitely help manage the symptoms. And importantly, specialized liposuction offers a way to physically remove that abnormal pathological fat. This can lead to significant improvement in pain, heaviness, mobility, and actual leg shape. So there is definitely hope. Myth number 9. Liposuction for lipedema is excessively dangerous or just cosmetic. It's vital to differentiate standard cosmetic liposuction from the specialized lymphatic-sparing techniques that are used for lipedema. When performed by an expert who understands lipedema and prioritizes lymphatic health, it's a medically necessary procedure for many, aimed at actual reduction of the symptoms and prevention of the progression of the disease. We use specific tools and techniques, for example, tumescent anesthesia, to maximize safety and target lipedema fat while protecting crucial structures. The goal for lipedema liposuction is both functional and aesthetic improvement. And finally, myth number 10. You need general anesthesia for lipedema liposuction. This is a myth I'm passionate about debunking because it relates directly to my practice focus. While some surgeons may use general anesthesia, extensive lipedema liposuction of the lower extremities can be performed very safely and effectively while the patient is awake, using primarily tumescent local anesthesia. This is actually my preferred approach. It avoids the risk risks associated with general anesthesia often allows to a quicker recovery, and patients tolerate it extremely well. If you suspect you have lipedema, or if you're looking for an expert treatment options like awake, lymphatic-sparing liposuction, I encourage you to seek out a knowledgeable board-certified plastic surgeon. Thank you so much for watching. If you found this video helpful, please give it a thumbs up, subscribe to our channel for more educational content, and feel free to leave your questions or share your experiences in the comments below.